Hello, everyone. Welcome to the town hall for the State Health Plan and Lantern Program. As you've seen, we've put out a lot of information about this program that started up, and we got a lot of questions on Facebook and email, and so we decided to set up these town halls so we can you can hear it straight from the boss's mouth, right, Thomas? This is Thomas Friedman, the executive administrator of the state health plan, who is with us tonight, and he is going to present about the program, and then we'll grill him with some questions, and then hopefully you'll be more aware of what is available to you with the Lantern program. If you have questions, please put them in the chat as we go along, and then at the end we will cover them as best we can. And with us, we also have Artis Watkins, the executive director of SEANC, and I'm going to put her on the spot and make her say a few words here just about the program and what's going on.
Well, thank you everybody for joining us tonight. And I know you want to hear from the health plan, and so I won't be long. I do want to say this is such an important partnership to us. I know our first vice president, Emily Jones, is on the call tonight, and we're very committed as an organization to working with the health plan and doing everything we can to support them in trying to bring your costs down. I want to say real quickly that it's a rare, not a rare, but it's an extreme pleasure when we can work with an agency because we believe wholeheartedly in what they're doing for employees and retirees. In this case, employees for the most part, because most retirees are going to be Medicare eligible. If you came on the call thinking Lantern has anything to do with Medicare, it does not. But you should stick around so you can tell folks who are still on the regular health plan what it's all about. But I do want to say SEANC for years has been on a kick about bringing transparency so that costs would come down. In other words, making providers tell us what we're paying them so that the cost can come down. That politically is a lift so massive, it can't be described. So the health plan has done something pretty remarkable. They have figured out how to focus on bringing costs down and bringing more competition to bring the cost down in unconventional ways. And this is the first of those ways. Thomas is not new to the treasurer's office, not new to health plan, not new to working in the healthcare field. And I really just want to say before we go into this, I know people are not happy that their premiums are going up. We're not happy that your premiums are going up. And I don't think Thomas Friedman or the health plan are happy that your premiums are going up. But the fact of the matter is, because they're going up, it's really important to try to find ways for you to save some money. So without further ado, but with a great big hopeful endorsement of this program, I want to say welcome Thomas Friedman, the executive administrator of the state health plan, to tell us about this program and to answer any of your questions. Thank you all for being with us.
Thanks, Artis, and thank you, everyone. Before I jump into things, I want to highlight a couple additional things. One, we have, Lantern is live now, and we have already gotten 160 cases going through. I really attribute a lot of that to the good work SEANC has done to push the message out and to drive people towards when they have a surgical question, call. We are only going to be successful working with you. So that is an area where, I want to give you guys a lot of credit for. It's been less than 2 weeks, and we've gotten over 160 surgical cases scheduled. So already 160 state employees are going to have previously would have had to pay in the hundreds or thousands of dollars for a surgical procedure are going to pay nothing are going to pay $0.00. That's one. And I want to hit on something else, Artis, you said, getting to work with y'all has been a great pleasure again. And another area where I think we're going to be able to really do some movement this year is getting CON overturned. I think that's something we have kind of signed on together. I see this as Lantern as a natural extension of why that's a good idea. And I'll kind of go through there. ASCs, ambulatory surgery centers, and kind of non-hospital based places are lower cost, high quality ways to get healthcare. And for a long time, hospitals have blocked those from getting into the state of North Carolina, more of those that want to really focus on procedures and really focus on care. And when we go to the table with ASCs, they're the first to raise their hands that they want to work with us and drive those high quality care and high quality outcomes. So thank you. And I think working together on things like this are only going to grow the things we can do. It only further drive down healthcare costs in North Carolina and give you all the care you deserve. So with that, I kind of want to jump into what is Lantern, where we're going, and how we're trying to think about things. And then, any and all questions would be happy to answer. So the first thing Treasurer Briner and I came in and sat down is when we wanted to think about the scale the state health plan has when we think about the state of North Carolina. The state health plan pays $3.9 billion on healthcare in the state of North Carolina every year for just medical services. Our members have 5,800 surgeries a year. We spend $270 million on that. We do from outpatient surgeries and procedures. There's 59,000 of them. We spend over $530 million on those things. Why is that important? Because we are about 10% of the state commercial volume. But we are the most consistent. State employees are loyal to their jobs, stay in state government for a long time. So as we thought about how can we drive these numbers down, the amount we're paying for care, we had to show providers and systems like this is how big we are and how much scale we have and how much we can impact your bottom line. And thinking through like the care we need to provide to make sure our members are healthier. So I don't think anyone's said it this plainly before. It's like, do you want our volume or do you not? And if you don't, that's great. But we're going to need a discount. We're going to need your best providers to do it. So the premise where we started from is we have a lot of scale in North Carolina that we've just not used well. We've never asked people to compete for state employee business. We've never asked them to compete with only their best providers. I don't want someone who's done 3 hip replacements in their first year out of medical school taking care of state employees. I want the best hip surgeon to be doing it. And I want to drive all of our volume to those high quality providers. So this is where we started is we're spending a lot of money on a lot of this care, and we think we could do better by y'all. So we partnered with a company called Lantern that is really focused on for those surgeries where members have a choice, where there's an option, right? We're not talking about emergency heart surgery. We're talking about hip replacements, knee replacements, valve replacement surgery, foot care, when you need a colonoscopy, even a colonoscopy, we can get, the example I've used in the past, and this is true, and this is where we're putting our money where our mouth is. Some facilities we're charging the state health plan $8,500 for a colonoscopy. The best center in Raleigh, you can get one for $1,150. So I could take every single member, pick them up in a limo, take them to go get a colonoscopy there, take them to the Umstead Hotel for 3 days, drive them back in a limo, and say, hey, we all saved money here as well. So we're amplifying that across our platform. Prices are variable. They're not transparent. It makes it really, really complicated. So we thought, what's the best way to make it easier for state employees to know what is the right option for them? Make it free. Make it as cheap as we possibly can. If we can save a bunch of money on services, you should save money first, is our mantra on this. We want to make sure that state employees are the ones that are saving money, because my ideas and what doctors want to do don't matter if members and state employees don't want to do it, right? If they don't believe us. And if we make it too difficult and too burdensome, y'all aren't going to do it. So we found a company named Lantern. It's been around 15 years. They also work with the state of Florida. They also work with the state of Delaware. They also work with Target and Google and other large employers that are really big, that have a lot of scale to say, we demand better prices, we demand better quality, and we want to make sure you can get surgical care close to home as best you can. So what types of services are we talking about for Lantern? Joint replacement, hips and knees, orthopedic surgery, spine surgery, bariatric surgery, pain management, heart surgeries, gynecological procedures, ears, nose, and throat, GI, things like colonoscopies and general surgeries. That's the network we're trying to build up. These are surgeries where you don't need to get that surgery the next day. You have to have a consultation with your doctor. Oftentimes, because of CON, you're waiting several months to get a surgery. By partnering with us in Lantern, we're going to help you schedule your appointment. We're going to get you in faster, and we're going to make your costs zero for that surgical procedure. Really important to us that you do not pay for these things, and that is how we are going to drive more volume to providers. So the premise of this model very plainly is, and SEANC has been the champion on this, commercial plans like the state health plan pay significantly more than Medicare and pay significantly more than Medicaid. And that's where hospitals and health systems make all their money. So we've said very plainly and very directly, we're not going to be your cash cow. You are going to give us a discount. And in exchange for that discount, we will drive as many as our patients to those high quality providers as you will give us. And how do we know they're going to go? Because we're going to make it free for them to access that care. So if you still want to get a surgery at Duke, if you still want to get a joint replacement at Duke, we're not taking your benefit away. It is going to cost you a copay, your deductible, and your coinsurance, which can get you into the thousands of dollars range for care. Or you can work with one of our partners and get it for free from the highest quality providers of that systems. So this is where we're starting. And we recognized when we started, we got folks all across the state of North Carolina, we got folks all across the country. So we got to think about, where do we have access to care? So I wanted to break down where you have options today, because we have state employees in all 100 counties. So you'll see, and it probably not a big surprise, right now the network is really focused. There's the most providers in the Triangle area and the Charlotte-Fayetteville area. I know not everyone lives there, and we are working on building the network out, and I've got a couple stories on that I want to share in a minute or two. But what's important is we're going to continue to put pressure on providers to join and be part of this network. But I think what's really important is, if you live in Asheville, if you live in other parts of the state, we will pay for your travel in the state of North Carolina to get you where you need to go for care. So if you live in Asheville and you want the right provider for you is in Raleigh, we will pay for your mileage. We will pay for your hotel. We will pay for your flight if we have to get you there. Because again, we are giving you the savings first in this situation. We are going to hold it to free for you. So this is where care is today, and I'm going to kind of give you a couple stories on how we're building out the network right now. And some of it is a little bit fun to watch hospitals and health systems squirm a little bit. They're not used to competing on price. Every year they go to the negotiating table with Blue Cross or Aetna or whomever and say 5% more money, 6% more money. As we saw earlier this year, if those folks say no, they're going to say, we're going to go out of network and we're out of here. We're not going to back down. We're not going to give in to everything everyone wants on things. What we're saying is, we're not asking you to give us a discount. We're going to commit to getting more volume to your providers. So you're not going to make as much money every case, but you are going to make more money overall. And we are deadly serious about quality. So I want to give you an example about that. I have never used a podiatrist in my entire life. I know a lot of folks need them and things. As we're trying to build out the network, we worked with a couple podiatry practices, agreed on rates, agreed on a piece of the negotiations. We got to the quality standards. They couldn't pass the quality standards. They're not going to be in the network. We are not going to ask you to go see lower quality providers who want to do things on the cheap. If they can't make the quality, we're just not going to let them in. But what's important is, we're going to grow this network. I was in Charlotte yesterday. We had the Triangle Systems today, working with them to get the best price, to get the UNCs, the Atriums, the Novants, the Wake Meds to the table, to continue to grow this network, to give you more and more choices as we go across the way. But so if you think you need, or you know someone who needs one of these procedures, the Lantern number is up there on the screen. Call them. They will help you with the scheduling the surgery, getting you a consult, getting you an appointment, and getting you into those providers, and it's free. And also for folks, I want to make this also very clear. For folks in the western part of the state, southern part of the state, north part of the state, we also have providers in Georgia, Tennessee, Virginia, that if there's not a close enough North Carolina provider willing to give you the highest quality care at the best price. We do have providers in other states as well for those folks that living in border areas. So if you don't see something close to your house on here, please still do call. I couldn't make a map. I don't have the map skills big enough to get Georgia and all those other states on here to like identify where we have practices and providers. But you are not limited to just getting care in the state of North Carolina. And that's how we're going to put pressure on these folks to come to the table. Just to say very plainly, you're going to give us a great deal with your best providers, or we will send our members for free to someone else and we will pay for them to get there. And that pressure is starting to work, and they have come to the table a lot more earnestly in the past couple of weeks to try to get on the table so they don't continue to lose those 59,000 procedures, those thousands of surgeries, those almost $1 billion in revenue that they have at risk if they're not able to work well with us at the state health plan. So kind of showing the map here again, if you're in one of the kind of surrounding regions of the state, we do have options for you to go to in Georgia, Tennessee, South Carolina, Virginia, to make sure you have access to care. So we are being very intentional about growing the network based on quality. And you see the names in the network here. These are high quality facilities. Cleveland Clinic, Johns Hopkins, HSS, Northside Hospital in Georgia. We are not talking about, small or like not excellent hospitals. These are excellent hospitals that our members can go to for surgical care free of charge for that surgery. And we will pay to travel for you to get there if it is really complex care that's needed. So we are very committed to continuing to build this out, but just know you have a nationwide network. So not every state employee works in the state or lives in the state of North Carolina. We got something for you too. So the exciting part is twofold. One, how do you access this benefit? I think is the right question and an important question. A couple ways to do it. I am not an app person. But there is an app that you can download, put in your information, and you can do your own. If you're the type of person who wants to do their own provider search and identify their own providers and practices, they have an app that you can go through and do all of those things as best you can. I would encourage you. I'm a little bit older, so I'm going to call their Care Navigator team. They will walk you through the process. They will identify providers that you might be able to go to. If you need help scheduling those providers, they will help schedule that care for you. Try to take as much burden off your plate, because again, we're just trying to align incentives really well here to make sure y'all are taken care of, because if y'all are taken care of by high quality providers, you save money, we save money together, and that is how we're going to grow and be successful here and really continue to push providers. So just know you're not alone in trying to figure out and navigate this system. We've got a dedicated team solely focused on working on the state health plan to help make sure that y'all have a wonderful experience when you call and that you have options for care. I'm gonna try to click. Okay. So I want to just highlight at the end some kind of key benefits. We're talking about the highest quality providers. Again, we have been reached out to by some folks that I think are well-intended, but just don't hit the quality threshold. They're not getting in. We at the state health plan are going to work with them to improve their quality so that they can get in, but we are not asking you to work with, doctors fresh off the street or not highly accredited doctors or folks that have a lot of readmissions. We are focused on quality as the front door here. We will pay for you to travel to get where you need to go. Because again, there's that much savings here. There's so much savings that we can make it zero member cost share. And we're going to continue to build out enhanced cost sharing at these practices. Some of it's complicated, right? So, and we'll talk about some of the practices that are in the network. But we want to get you to those practices so you don't have to switch doctors a bunch of times. So we are going to lower our copays for all the doctors within those practices, so that you can have access to that lower cost care all the time. Rondra, no, there's no limit to this. If you need surgical care or you need surgical, it's not limited to one per year or one per quarter. I am very hopeful folks don't need multiple surgeries in a year, but I recognize they might. And you are not limited for using the surgical benefit. You're not limited. Let's say if you got a colonoscopy, that doesn't mean you're not eligible for a hip replacement or joint replacement or spinal care or bariatric care. You remain eligible. In fact, we want you to use these things as much as you can for when you need this level of care. So opposite of limits, please, don't have surgeries for fun, but anyone who's had a colonoscopy, I don't suspect is going to do that for fun anyway. but we're not limiting members in how much they can use this program. In fact, the opposite. We encourage you to use it as much as you can.
Hey, Thomas, we'll get to the questions after.
Okay.
I don't want you to be
Sure. Fair
distracted.
enough. Yeah. So just kind of a couple pieces. Like I mentioned, we already have 100 cases in queue, and a large thanks to the work and advocacy of SEANC. So we are very thankful for y'all for being our partners in promoting these things. We haven't mailed out ID cards yet, but just by word of mouth and people hearing about things, they're calling, trying to find out answers to care. We had one member who by having heart surgery through the program, the state health plan saved over $60,000. They were very early in their benefit. They would have been on the hook for about $8,000 or $9,000. So in real time, we are seeing results that are really useful and really meaningful to save money for our members and save even more money for the plan. And kind of going back to where artists started, that's how we keep premiums down, is by having this program be successful. So when you're seeking care, it is free for you. So you're going to save money. And the more we use these providers, the more we get our costs down. So premiums are less likely to go up. So this is where we're starting, but we are going to build this out going forward. And I think it's a tough message to get your head around, because it's counterintuitive to say when we say free at the state health plan, we mean high quality care. We need to make high quality care affordable for members, and this is kind of our first step to it. You'll see copay reductions for using other types of services at these practices that will be rolling out. We're not taking anyone out of our network just yet, but we are going to continue to make it more and more affordable for state employees to work with primary care, specialty care providers that are helping us build up this model of care. So just kind of a couple other things. Again, we're really focused on engaging the member, teaching you about your benefit, finding the right surgeon, getting you a consult, getting the procedure done, and continue to follow up. And even if you don't need surgery, I think something that's really important and interesting to remember is there's other benefits that we are offering you as state employees. So if you think you might need orthopedic surgery, the doctor's like, hey, I'm not sure. We'll pay for Hinge Health for you to have at-home PT care, at-home pain management care as well on top of that. And the best surgery is when you don't need. So we are also trying to create incentives for you to help manage your health and your health outcomes at home. And we are trying to make that as free as we can too. So that is what I wanted to share at a high level here today. I want to make sure there's plenty of time for questions. And so I'll turn it over to y'all if you got anything to kind of go off of.
Okay, so like I said, we did solicit a few questions. I want to ask one question just off the top, though, because we have seen some skepticism on our Facebook page, and you know, because it just sounds too good to be true for some folks. Can you explain how the plan can offer free surgeries? How is this possible, I guess?
Yeah, so I think it goes back to that colonoscopy example that I shared, right? Because providers aren't transparent in the price and cost of things, and because we haven't forced their hand, there's just tremendous variation in cost and services. So, you know, right now, a member who wanted that colonoscopy, you'd pay about $600 out of pocket. Because of how our plan design is structured, if you went to a low-cost provider, you're still paying about $500 out of pocket. So that's not really an incentive to get members to go to that place that's $1,000 versus $8,000. So we're to put our money where our mouth is and just say, okay, if you go to the one that's $1,100, it's free. When we think about shoulder surgeries, you know, a normal shoulder surgery, I can't believe this is normal, costs somewhere between $36,000 and $72,000. If we pay 135%, 125% of Medicare, it's closer to $18,000 or $19,000. So we're going to pay for a shoulder surgery one way or the other, but if we can get it for less than half the price, the way to get folks to do that is to make them not pay for it, right? Because if you don't see a cost savings, you're going to do whatever's closer, whatever's easier, like word of mouth thing to do, because that's the right thing to do. So we recognize costs are going up, so the more we can make it free or low cost, we'll get the savings last. The state health plan, to be clear, is taking the savings last, right? There are some of the things we are offering for free where you will save hundreds of thousands of dollars. We might save 10 or 15 bucks, but we need to get in the culture of partnering and steering volume to those folks that want to work with us and give us a discount. in order for this to be successful.
That's amazing. So I guess just question, why is Medicare excluded? And can you just explain that this is?
Sure, yeah, that's a good question. So Medicare, generally speaking, Medicare or Medicare Advantage plan is a fully insured product where Humana the federal government takes a lot of the cost. And Medicare generally pays at cost for things. So in these plans, commercial plans pay between 2 times and 3 times Medicare for a lot of services. And we're getting a discount trying to get them closer to that 135, 115, 145 piece of Medicare. Medicare already pays less than that. So it's not an incentive for the providers to kind of engage in the program the same way. We are going to continue to look at options that make our Medicare plans more cost effective and affordable. But this model, just as paying as a percentage of Medicare, doesn't necessarily, because I can't control Medicare rates. I have kind of no say and no authority over those. That's a federal issue that they don't pay attention to me on that stuff.
Okay, yeah. That just came up a few times. So I'll go back to the chat here, and John C. Hodges asks, what is the process for an institution to sign up? What standards and measures are used to prove that they are high quality?
Yep. So 2 paths right now to join the program, right? We did something like an RFP for all the health systems across the state in the 6 regions of the state and said, here's a list of services that we do a lot, our members utilize a lot of throughout the course of the year. Give us your best rate that you can do, assuming the trade will be, we will make it free for our members to go there. So, right, give us a discount, you'll get more volume. So we started talking about price with those providers. And then, so this is the health systems where we're still kind of working through. And then for those specialties, so you'll say shoulder surgery is what we're bidding on. The team at Lantern goes through, where did you go to school? What are your postgraduate accreditations? And then they go through 3 years of case logs looking for, were there accidents? Were there infections? Were there readmissions? Were there mistakes? Did someone have to come back in 30, 60, 90 days? And then they narrow that down based on only the best of the best and say, okay, we will agree to partner with you at the rates we've discussed, but only these doctors are eligible to participate in the program. So Lantern has a clinical care team of literally, dozens of clinical folks poring over every file of the last 3 years for the surgeons there. And generally speaking, we're not trying to get those 1st or 2nd year surgeons in the program. We want folks to really kind of have some experience and demonstrate they're really good at something. Healthcare, the more you do a specific type of surgery, the better you are at it. The other way, for non-health systems, not Dukes, UNCs, Wake Meds, Novants, we're looking at the map and then identifying, okay, we have a gap in this area. Some areas just don't have someone doing that thing, so that makes it unfortunately easy. The rest of them, we are sitting down with those practices, explaining the program, identifying the program, and then going through the same process. Like, we'll agree to be your partner, but we're only going to talk about a subset of your doctors who pass the same clinical care criteria. So 2 different podiatry practices across the state got to the place that they had agreed on rates, they'd agreed on what they were trying to do. The providers, the surgeons, the proceduralists did not meet the quality threshold, so we canceled the conversation, right? So we are only going to mention quality.
Are endoscopic procedures covered?
We are working on blowing out that's the wrong choice of words, but also the right choice of words. We are building that out right now. We had a good meeting with a couple practices today. So colonoscopies will be covered, endoscopies will be covered. For folks in the Charlotte area, there is a couple options down there. Folks are welcome to leverage the travel benefit for that. But that's an area we continue to focus and build out. We have tens of thousands of those a year, so we're working to get more practices in there, and there's a material savings there. So yes, those will be covered in the program as well.
Okay. our physical therapy services covered, and I know you mentioned something about that in your presentation, but
Yeah. So right now, no, the bundle and the free is for the surgery and the procedure. However, we do have a partnership when you reach out to Lantern for some of these things. We have another partnership called Hinge Health, which is at-home PT services that help you with like kind of pain management pieces. That will be free to members who surgery is not deemed to be the right option for them, providing different options as well. So that will roll out in January or February. So there will be additional services around PT that will be provided for free. That'll be an in-home benefit that's provided by free. It's a really, really cool program that I would encourage you, if you are utilizing PT for orthopedic services, to reach out to the health plan at the beginning of the year to kind of figure out, hey, is this the right thing for me? But again, please start with, if you think you are going to need surgery, let's reach out to Lantern. We can make that additional benefit available for you. But we want to make sure if you do need surgery, let's make sure you get the surgery you need.
okay. So this question is one that we got a lot from a lot of different people. Basically is, what other surgeries are offered, or is there a list of providers that people can reference?
So yes, so we are building out the website with the list, and want to kind of go back to the map, kind of from a regional point of view, and then so kind of like this is where like the geographic footprint of it is. We are continuing to build out the list. Why we have not published the full list yet is because we are in contracting phases with a few of these, and we don't want to get too eager and put folks on and kind of jinx ourselves. But I would tell you the practices right now that you could go to. Wake Med Bariatrics is a member. Carolina ENT for your ENT procedures. Ortho Carolina, Carolina Orthopedics, Delta Joint Management, Pinehurst Surgical Clinic are a handful of the ones that we are going through right now that are approved right now. Raleigh Ortho, Premier Bariatric Surgeries, their location in Raleigh, but also their location in, looking back at the map, in the Fayetteville and New Bern area as well. So the network is there are options for these things across and around the state, but we are going to continue to build those out over time. One, we want to make sure that we're not building it too big, so there's not a financial incentive for the providers. And two, to a question I saw pop on the screen, the contracting process is taking, it takes the time it takes. It's not going to take 8-12 months, but we just went out to bid for that in October. So in the coming months, the network will continue to kind of grow and build. But just do know, if you need a complex surgical procedure, please still do reach out, because we will, if there is, for some complex care, Cleveland Clinic, Johns Hopkins are some of the best in the country for things. I would rather pay for you to fly and travel to go get the best surgical care in some areas in the country than delay and waiting for something in North Carolina. And that's part of the reason we have a travel benefit, is we want to make sure that folks are able to access that care when they need it and where they can get it.
Sorry, I was muted. So you did talk a little bit about why Medicare patients aren't eligible, but this question is, what about folks that have the state health plan and Humana as a supplement? Is that the same case?
Same case, yeah. So if you have Humana through the state health plan, then Humana is responsible for those claims costs. And again, so generally, if you are on Medicare, we are already paying less in this scenario. So you're in Medicare pays first there. So I don't have the same authority and kind of payment rules with Medicare, because we're a secondary, in some cases, tertiary payer for those services.
Okay. Yeah. All right. So this question is, you mentioned colonoscopies, and they're asking to give locations in Raleigh. I assume they would just need to reach out to this.
Yes. Yeah. Reach out to the Lantern. Colonoscopies are not yet in Raleigh. So colonoscopies are not in the Raleigh area yet. There are other practices where we are working directly with Raleigh Medical Group to make sure that the option is available in the Raleigh area. And we're hoping to close that one pretty quickly.
Okay.
We should have that up by the beginning of the year when the benefit starts. So we're kind of soft launching what we have now.
This is a good one from Reginald. At the beginning, he's at the beginning stage of having knee replacement surgery. How does he start with Lantern? Like, where does he start?
Call the number. Call Lantern's number. I will bring that back up on the screen. Do. If you were just starting to go down the process, that share button is always tricky. If you are like me and have a hard time seeing with glasses, I'm going to try to make it as big as I can. Reginald, if you are going down that road, please call that 1-833-916-3826. And they will get you going where you need to go. They will help you starting now. So please do reach out. And it turns out, maybe you're not quite there on the surgical journey. If you're working with like Ortho Carolina, for example, we are going to cut your copay down, so you'll be paying less per visit as you go along that journey.
Okay. Is imaging covered?
Imaging is not currently covered. We are looking at a program for high cost imaging and diagnostics. We're just focusing on the surgeries and procedures right now.
Okay. Duke providers, are they in the program yet?
Duke providers elected not to be one of the options of the program. If you kind of remember going back to some of the rate issues we just had with them, I think they chose a different path.
Fair enough. So this person says, if you have an injured shoulder, but don't know if you need surgery, how is this process handled?
Please call Lantern if you think you have a shoulder injury. They will get you a consult with a provider in your area. That consult will be free to you. If you don't need surgery, we can help you we can help you through Hinge figure out a PT solution at the beginning of the year. But if you need surgery, they'll get you going where you need to go.
And you mentioned in our podcast, shameless plug for the podcast, Scenic View. We have an episode on this topic a few weeks back, but you mentioned that in some cases, people won't need surgery, or that you.
That's right. Yeah. And so we're also incenting providers for when they don't do surgery, right? So if we find a person doesn't need surgery, we're not just trying to do surgery for surgery's sake. We do have a rewards and incentive structure for like helping folks that don't need surgery avoid surgery. The best surgery is when you don't need. And that's where the high quality provider comes in, right? We're not looking for the snake oil providers. These are folks that are proven that surgery is the right option for them. And that's why we make the consult free to the member. There's different paths you can work within the practice, so we'll reduce the cost sharing there to help you kind of lessen the burden there, assuming you don't need surgery. So we have incentives in place, so they're not going to just jump to surgery. If surgery is not necessary, we're not going to do surgeries.
Okay. So what about non-surgical procedures like cardiac ablations?
So that is on the list of things to get to. That's what we're working with the health systems, is to figure out, because a little bit more on that is a little bit stuff more on the health system side, and they are a little slower, candidly, to come to the table than ASCs and the folks we're trying to work with in the CON construct. But from a health systems, we are working with them. We're trying to get all the cardiac procedures in there as well.
Okay. What about people who have already paid and are going through the surgery process for bariatric labs, x-rays, and not in network, but have already spent out-of-pocket money?
So if you have your surgery scheduled, if you have those pieces done, you should stay with the provider you're doing, like the construct you're working within. Like, please do not break the continuity of care. I don't think that is the best thing from an outcomes perspective. So that would be my recommendation, would be stay with the providers you're working with now. If you have those things scheduled and you're far down the road, I wish we could have gotten this up and going sooner, but it is a kind of a complicated process to kind of try to make sure we get in there. So to the question, if you are on your care journey right now, we're going to pay for you to complete your course of treatment of care. We're not going to ask you to stop what you're doing. So those folks that have things scheduled within the next 30, 60, 90 days, we're going to honor the commitment you've made that you started down this road process. We're not going to ask you to switch providers midstream.
Okay. What if we're already in the process of having surgery and going through the steps, but the surgery is not able to be scheduled until the first of next year? but my provider has never heard of Lantern. Do I need to start all over and find a new doctor?
So I'm assuming this is related to bariatrics. No, if you've been working with a surgeon, we're gonna move to the mandatory model a little bit later in the year to allow for folks to kind of finish their pathway, so that they are able to access those pieces of care. Go prospectively, we are going to close the network as we try to grow the network, but we do want people to finish their kind of care pathway that they're on right now and not ask them to switch things midstream. If you've had your first visit, like literally like the first visit, I could see why you might want to wait for a couple of months. I'm not a doctor. I can't tell you that that is the right thing to do. I would work with your doctor on that, but I would understand where you're coming from on that. But we're trying to be flexible with our members who are in a care pathway to not ask them to change in the middle of it, because bariatric care is very complicated.
Okay, and what about ECU Health? Are they?
So we're talking to ECU about a couple procedures. Again, this is a program that's going to build and evolve over time. We ask people to provide their best rates and offers. Some folks in some areas were just plainly not competitive. Like, we'll give you $10 off, and that's not an exaggeration. We'll give you $10 off our current price. That's not what we're trying to do and try to solve for here. So I think from a health systems perspective, we'd love to get ECU in a lot of key areas. We'd love to expand in the eastern part of the state. But the way we're going to get them in is to make sure that they see the volume that they're losing by not bringing their best to the table from a rates and quality perspective. And I feel confident ECU will.
Okay, and so there's a question, I guess, and this kind of brings back the point about it's kind of too good to be true. Do we pay anything out of pocket for the surgery?
For the surgery, you do not pay out of pocket.
Okay.
For the consultation, you do not pay anything out of pocket. We are paying for that. If there's PT afterwards, that is not part of the bundle. The care after the bundle is like surgery is separate. But again, we're trying to make the cost sharing better at those practices to kind of further incentivize y'all to get to those practices.
Okay. And Allison is asking how will it get paid? Bariatric will only pay with Lantern. You just mentioned that you'll allow them to finish their.
We're working as hard as we can to make it set up through Q1. It might be February, but we're working as hard as we can to make sure for folks that are scheduled that are down that pipeline, we are going to pay for that care. That that's the right thing for us to do.
Okay, and so this question is from Renee, and it says, in regards to colonoscopy, doesn't the state health plan already cover colonoscopy for screening purposes?
There is different age cohorts where preventive colonoscopies are free. There's quite a few, especially the more complicated ones, that are not free.
Okay.
We are willing to make all of them free in this circumstance and context. So, for example, I'm 44. I got a colonoscopy last year. I would not be yet eligible for the preventive kind of colonoscopy benefit. In this circumstance, it would be free for me if I went to the place I was kind of within the network.
Okay, and I think this last one that I see on the screen, that maybe I can help a little bit with this one. How can we tell others about this program? You can visit our Facebook page, share our comments. Our posts on this topic. Get your friends to join SEANC. Very important. And share. We send out a scoop every week, every Friday. You can forward that to everyone you know. And that's one way that we can help. We also have a town hall tomorrow night in Morganton in person, if anyone wants to come to that. And so
I'll be there.
And Thomas will be there. And we're planning some events in Goldsboro and Raleigh as well. So stay tuned to that. And let's see.
But tell your coworkers, tell people at church that are state employees. Just talk. That's the way things get around, and people start investigating it after they hear word of mouth.
And tell people who aren't state employees. Maybe that'll make them want to be state employees, right? So
for these, for Renee, please don't call at none of these situations. Please call Lantern. Lantern is the entity that will be doing the free services from. call Aetna's our TPA for a lot of things. For the free benefit, please call Lantern.
Yeah. Okay, and there's a question, back to the shoulder question. Consult is free, but a physician orders CT imaging, is that not covered?
I don't believe imaging is, if it is part of the consult, I think that is an area it's a bit of it depends question. It sort of depends on the procedure, and that kind of depends on what they need to do for the consult. That is an area I can have a more buttoned up answer for y'all tomorrow when we're kind of sitting on. But unfortunately, it depends kind of on the procedure and the type of things. If they can read the results that they are already in place, I think there's different kind of ways that they go through that.
Okay, and Jimmy, we will post this version of the webinar on our website. Tomorrow night's is not by Zoom. We can probably host another one if Thomas is willing at some point. And I think it's been very beneficial. I think I'll go back to the questions that were submitted in advance. Just briefly, the only one that I can really see that we haven't covered is about members' family. Are they eligible for this program as well? Like, I guess they'd have to be members of the program, of the plan.
If they're members of the state health plan, then they're covered, yes.
So it's open to everyone, not just the employee, right?
That's right. Anyone you're paying a premium dollar on is eligible, is covered under this.
Okay. All right, and yeah, like I said, we will post this and we'll include it in the scoop on Friday as well. Artist, did you want to say anything? I think that looks like all of our questions as of now. So
No, I mean, John, you mentioned earlier that Thomas Friedman has come on the Scenic View podcast. If you'll put a link to the podcast in the chat, I've told people several times when I've been speaking about this, it is really hard for us to describe it. But what we have learned when he's come on the podcast is that people say the way Thomas describes it, they understand it better. So if you, John will put a link to the podcast or something about how to get to the podcast. And that will, if you listen to Thomas talk about it, I think a lot of this will gel for you. And it's something when people ask, how can I tell others about it? Send that podcast to them so they can just hear the state health plan talk about it themselves, because they do a great job of explaining why they're doing it and kind of how they expect it to work. But I think these questions have been really, really helpful because, goodness, a lot of these questions I had never anticipated. So thank y'all so much.
yeah, and I just put it in the chat, the link to that specific episode. You can also go on our Facebook page and look back a few weeks and you'll find it there too. I did have one more question. If a surgery is needed and it's not offered by anyone in NC, you mentioned that you have a nationwide network, and this person said that they found a surgeon in California. So would you still tell those folks to check into Lantern?
If there is a surgeon in the Lantern network, then they are eligible to use that provider. I would say the best care is the care closest to home, so that we're trying to get folks as local as we can, but recognize that is not always an option for some types of care. So there is, if we don't have options available for you locally, we want to make sure there's options available for you. So please do reach out and check.
Okay, and to be clear, if you're retired but not on Medicare, you can access this program, right?
Yes.
Okay.
Yes.
Okay. Well, I think that's about all we have tonight. Like I said, tomorrow night we'll be in Morganton at Western Piedmont Community College. I think it's called the Leviton Auditorium. It's starting at 6:30. I think there's going to be food, right? Right, artists? Food.
Yes, there will be food. Our 3 scenic districts from that area are going to make sure there's food there. So
yeah. And also, we are planning events in Goldsboro and Raleigh in coming weeks. So thanks for joining us tonight, and thanks, Thomas, for all your information.
Thanks, y'all. Thank you, guys. Thank you for everything.
Thanks.